today, and today I'm going to be performing a newborn assessment. I've already performed hand hygiene. Looking at my patient, she, her color is pink, her posture is flexed, her head is 1/4 the length of her body, and there are some milia, stork bites, and erythema noted. Now I am going to observe the baby's respiration. I'm going to do so by placing my hand right here in between her chest and her abdomen. I'm going to listen for 1 full minute. I listen for a full minute because sometimes babies have irregular respirations, and sometimes they experience short periods of apnea. The normal breaths per minute should be 30 to 60 breaths per minute. And while I do this, I'm going to observe for signs of respiratory distress, such as circumoral cyanosis, retractions, grunting, asymmetrical movements of the chest, rapid respirations, and flaring of the nose. And, um, and after about a minute, her respiration is 42 breaths per minute, which is within that normal limit of 30 to 60. And if a baby is delivered via C-section, you may note some extra fluid sounds in the lungs because they didn't pass through the birth canal, which allows it to expel that fluid out of their lungs. Next, I'm going to do the cardiac assessment. I'm going to do so with the pediatric side of my stethoscope. I use this side to eliminate any extra sounds, such as background, and I'm going to do this for a full minute. As a regular newborn, heart rate is 120 to 160 beats per minute, and hers was 145 beats per minute. And now I'm going to palpate her brachial and her femoral artery. Alright. And we don't routinely check blood pressures on newborns, but if we were going to, the normal systolic would be 65 to 95, and the normal diastolic would be 30 to 60. Now I'm going to check her head. The average head, or the normal head in centimeters, is 32 to 38 centimeters, and hers is 34 centimeters. And her suture lines are approximated. Her fontanelle, her anterior fontanelle is diamond shaped, and her posterior fontanelles are triangular. Alright. And if her fontanelles were sunken, that could be indicative of dehydration. And if it were bulging, that could mean that there was increased cranial pressure. The caput cystoideum is the swelling of the crown secondary to pressure on the baby's head. as she descends through the birth canal. This takes about 1 to 3 days to go down. And cephalohematoma is a bleeding between the periosteum and the bone that doesn't cross the suture line. And those are abnormal findings. Her eyes are brown. Her ear, the pinna, is equal to the cancer right at the eye right here. And if there were any pre-auricle skin tags, that could also be linked to renal malformations. And now I'm going to check for her nostril patency. And to do this, I'm going to cover her mouth and block one nostril. Alright, and her nose are patent. Her nostrils are patent, sorry. Now I'm going to check for her waiting reflex. Alright, and that is good. Her face is symmetrical, so, and if her face wasn't symmetrical, that could be indicative of facial nerve damage. Also, circumoral cyanosis usually goes away when the baby begins to cry because they take in more oxygen. And if it doesn't go away while she's crying and it actually increases, that could mean that there could be other serious problems happening. Her neck is short and thick, and it's got folds, and it moves side to side easily, and I see no webbing, and there's no fat pads. And while I have her in this position, I'm going to go ahead and check for her. I'm going to check the clavicles to make sure I don't feel any palpable lumps, which could be indicative of fractures. Her chest is cylindrical. Her swollen nipples could be related to the mother's hormones because she was just born. And the measurement at the nipple line should be 30 to 36 centimeters, and hers is 34 centimeters. Alright. And now I'm going to listen to her bowel sounds before I palpate them. Her abdomen is soft and round and symmetrical, and we only expect bowel sounds after a few hours after birth. So it's completely fine that we're not hearing any bowel sounds. It's actually a good thing. Her umbilical cord, it consists of 2 arteries and 1 vein, and it is a bluish-white color. And over time, like as time goes by, it will get darker. There's no bulge around her umbilicus, and if there were, that could mean that there was a possible umbilical hernia. And now I'm going to check her Moro reflex. I'm just going to lift up her arms straight, and then when I release them, it should go down into a C position. Alright. And now I am going to check for hip dysplasia, and I'm going to rotate the hips with the knees flexed, and we're going to check This helps us check for hip dysplasia. Sorry. And what we don't want to see is the femoral head sloping into the anterocetum. And now I'm going to do the palmar reflex. And what that is I'm going to place my fingers right here and she should grip down on my fingers. Good. Good. And now I'm going to do the if there's an extra line in the palm, that would mean that there might be a genetic problem. Alright, and there is no webbing noted. There's no extra digits. There's no cold feet. And now I'm going to do the plantar grasp, where I put my fingers right here, and her little toes should like grip my fingers. And next, I am going to do the reflex, and I'm just going to run my finger from the ball to her heel, and her toe should hyperflex. All right, and now I'm going to check her back. All right, her back should be flat and straight, and there's no tuft of hair. A tuft of hair could mean that there's spinal bifida. We're going to check for sacrum densum, which could be indicative of like cyst sinuses. And we're going to look at the folds in her buttocks to make sure they were equal and to make sure that her leg lengths are equal. And they are. I'm going to check for Mongolian spots, which is most common for African American babies and Hispanic babies, and this Caucasian baby does not have any Mongolian spots. And now I'm going to check her genitals. Alright, her labia is edematous. There's vernix present in the folds. And there may be small vaginal discharge or bleeding due to the mother's hormones also. Alright, and I'm going to observe her anus. I'm checking for anal fissures, and there are none present.